Again on. Now I'm gonna expose something for you so you understand. With this cervical cancer right here, they tell you they got new findings on it. We go talk about it because they're never gonna tell you what caused cancer, period. And they will never bring you a real solution. Just remember the mag tell you, I've been doing so much videos on these things to break it down to let the masses understand. They will never come to your rescue. They come with more options that can lead to your destruction, but never come to save you for real. You have to pay attention, and if you keep doing what they tell you to do, you're gonna keep having this problem and it's gonna be worse. Pay attention here while I give it the bam. Make it
After
run.
decades of declining numbers, a new report from the American Cancer Society finds cases are increasing for women in their
Listen to them, what they just tell you, people. They say it was basically decreasing. The number was dropping, and all of a sudden, it go back on the increase side of things. What happened? You have to understand, people, they're doing a lot now to put more chemical in the human being body. You see all these things they come out with and tell you now we got a shot for it. What you think? Those dangerous chemicals that they're putting in the human being, setting off all these disease and cancer, messing up the people, and you can't understand what they're really doing? We in a controlled environment. Anything happen to you, including sickness and cancer, they're the one who give it to you. You have to understand that. Listen here.
30s and 40s. So we have NBC News medical contributor Dr. Natalie Azar here.
And yes, look at this man in a drag. You can tell. Look at the neck. You don't have those bones in the neck if you're a real woman. And like I tell you, they're never real doctors. They just bring them to convince you of this bullshit. You have to understand they're gonna get you deeper into the trap with these people right here trying to convince you that they know something. Listen.
To help us understand what that means, good morning to you. Guys, nice to see you. So why the sudden uptick in slightly older women now? Two topics for the discussion this morning. One is going to be about HPV, and the other one is going to be about cervical cancer screening.
Okay, but you just hear the question, people? You don't understand. And just in case you don't know, these supposedly TV characters right here, they might ask the right question, but they will never answer it. You understand that? They will duck and dodge. These people are gonna still look good in the eyes of the dumb people. They ask the right question, but where is the answer? Pay attention here. Watch this. Go back.
So why the sudden uptick? And
why is this sudden uptick? Okay, let's listen if that person that they bring on as a professional is gonna answer that question. Pay attention here, people. Listen.
slightly older women now.
You see, and it also, after it asks the question, it go, also older woman now. Which one of the question you're gonna answer? Listen.
Natalie Azar here to help us understand what that means. Good morning to you. Guys, nice to see you. So why the sudden uptick in slightly older women now? Two topics for the discussion this morning. One is going to be about HPV, and the other one is going to be about cervical cancer screening.
Yes, those two supposedly dangerous things that happening to the woman, the females, these cervical cancers and all of these things that they have, dear people. And now they're gonna tell you, look, we need to find it earlier so we can treat it. Like I tell you, once they find supposed to be cancer in your body, yes, the government take you over. Now they're ready to finish you off. That's what it is. 100% in.
The discussion this morning, one is going to be about HPV, and the other one is going to be about cervical cancer screening. So HPV, a virus that is the most common cause of STIs in this country, is responsible for greater than 90% of cervical
cancer. Yes, they can tell you all of these things about the cancer and everything. They know exactly the damn cancer all the way down to the T, but they can never tell you what causes it. They just want to supposedly diagnose you early with these cancers so they can start the treatment. Is that a joke, people? They never explain. The only time you hear them mention something that causes cancer is when they tell you about those deadly chemicals that seek into something that you're attached to, like the PFAS, the forever chemical and them things, but they're never gonna tell you what really causes cancer. It was created by the people who control you here in this controlled environment. This is what they surround you with, so you have to pick it up somehow, somewhere. Everything that you use, that you associated with, got those deadly chemical in it, those cancer-causing chemical. And they're never gonna tell you right here.
In 2006 was when Gardasil was first approved. That's the that's the HPV cancer vaccine.
You hear that, people? They approve a vaccine from then, and they still have this problem right here because they juice up everybody, just like you see them do for the COVID, and then they tell them they still have the damn virus. You don't get it. The medical industry is a trickery, 100%, an illusion to capture the masses, lead them down the road of destruction. But a lot of people trust them, and that's the reason why they're using them to take you down.
Vaccine. That generation, and the women in their 20s and men as well, are really the first generation to benefit from that. So it's working. So
what
it's
a
working.
Joke.
And
yes,
women
it's working. You see their face? This sodomite right here that come on TV to trick you. Yes, it's working. They never give you something that works. You better understand. Like I tell you, they just add another option. You want to sick by this or you want to sick by that. They might tell you have a sickness, so now they have to cure it. They come with the actual disease, the destruction, to cure a fake disease. That's how they do it.
Their 30s and 40s kind of missed the boat on that vaccine. In terms of cancer screening, according to the CDC, greater than 50% of women who were diagnosed with cervical cancer either had not been screened recently or ever, or in the last 5 years.
And that's the reason why they got the cancer, because they wasn't screened. Wow. Unbelievable dumb shit, people. They have the cancer because there wasn't no screening for them. So that means the cancer developed because the screening wasn't there. So if you screen them, they wouldn't go have the cancer? Are you trying to tell the masses that you have to get screened so we find it and treat it? That's what they're trying to tell you. Early detection is the best, and then they start the deadly treatment. You have to understand it's a wicked world you live in. Again,
HPV and screening is what we really want to concentrate on this morning. So with the HPV vaccine.
HPV and screening. Wow, because they have the vaccine for the HPV. That's what it is. So they want to tell you, yes, we got the vaccine for that. And then we need to screen you for other cancers real early, because you know, polluted with chemical. They guarantee you that you're going to have the cancer earlier.
Should be getting that. So you can start as young as the age of 9.
Listen, people, the age of 9, people, to take a vaccine for supposedly HPV. Take a look at this right here, people. Are you kidding me? 9 years old? Wow. Like I tell you, how wicked world you live in. Just like they bring the COVID vaccine all the way down to 6 months old and vaccinate the baby mama, the pregnant woman. Wow. And you tell me that you don't understand what they're about here? The CDC, the FDA, all of them, the World Health Organization, all of them here to kill the masses.
And for girls, around 11 to 12 is kind of ideal. Also, ideally before they become sexually active, but also after. Again, it's so common. So once you become sexually active, it's very likely that you...
Before you're sexually active and after, you need to get these things right here. Listen.
Very well might be infected with HPV. It doesn't necessarily mean you're going to develop cancer.
Wow.
But it is approved through the age of 45. So if you're above, usually we think of 9 to 26, but if you're above the age of 26 and you're potentially at risk, for example, some of my patients in rheumatology who are on immunosuppressive medicines, it's now a recommendation to actually get them vaccinated.
Wow, people, like I say, in the new world, the name of the game is vaccination. They're gonna come up with a vaccine for every single thing. They put these problems out there that keep nagging the masses. And of course, the solution is vaccination. What a dumb world we live in. And I keep asking you, these wild animals out there, why they don't take sick and the whole population just die off? Because nobody vaccinate wild animals. Nobody treat them. Nobody do anything at all to help them like they have to do the human beings, the most advanced beings on earth. They need so many assistants. They can't live without assistance in this devil earth. What is that about? Why they have to be there joking you to keep you alive? You don't get it. Listen.
9 and 14, it's 2 shots. Older than 14, it's a 3-shot series. 3 shots.
2 shots and 3 shots. There you go, people. Another supposedly vaccine where you have to take in doses. Listen.
And that's it. Not for life, but for life. For life, yeah. As far as we know.
He mentioned not for life, but what it is. What it is if it's not for life. Listen.
It's a 3-shot series. 3 shots for
series.
And that's it. Not for life, but for life. Oh, for life. Yeah, as far as we know.
Life,
okay,
but for
right?
life.
All right.
And what about for males?
Also important. We link HPV vaccine because it's so important in preventing cervical cancer.
Wow.
But HPV is responsible for over 70% of oral and throat cancers, and it's also responsible for other cancers, anal cancers, and things like that.
Go back again, people.
But HPV is responsible for...
What the fuck is HPV? Wow. They tell you the HPV caused the cancer. What the fuck is HPV and how do you come by it? Is something that naturally just happen in your body? Where does it come from? These people is not there to tell you these things because they will expose themselves. They're the one who's selling you cancer. You have to understand that, people, that's what they do. They're here for your destruction. And you're going to say to me, Mag, then why did they have so much people and why they didn't... They have to house you, like I say. They're harvesting souls. They have to birth you, grow you, feed you, lead you to your damn death. That's what it is, people. That's how they get your soul in this devil earth. That's all it is. They have to make you live and die. They're responsible for both. They're responsible for you living on this side and dying right here. That's how they get your soul. They birth you and then they lead you to your death. Don't tell me they didn't birth you because you have to go to a hospital. Wow, you don't get it, man. This is a devil earth you're living. That's why they have full control of you right here.
Over 70% of oral and throat cancers, and it's also responsible for other cancers, anal cancers, and things like that. So men absolutely are at risk and absolutely can be vaccinated as well.
Yes.
Well, for women, we talk so much about mammograms and getting screened. What about for cervical cancer? So I feel like many years ago when the recommendation changed where you didn't need a pap smear every year, the people sort of said,
oh. That? How did the recommendation change? Because they know it was bullshit from day one with that pap smear. Supposed to be yearly thing. Have the doctor digging in the woman's vagina all day. Say searching for shit. Checking to see if you have cancer or any kind of problem. It's a damn hoax. I already told you. The more their hands on you, the more they can diagnose you. You have to understand that. And I tell the people in America, this is the reason why they give you Medicaid, give you supposed to be insurance, health insurance. So you can always keep checking. Yes, it's free or almost, a little bit of change it costs you because the insurance helping you out just to push you in that direction. And all those people who have those supposed to be healthcare insurance in America, they already get operated on and everything. That supposed to be force them to do these check-ins. And of course, you keep checking, the doctor gonna find something.
I don't need to go to my GYN anymore. Not true. Here are the recommendations for cervical cancer screening for women. You start.
Listen, because these people run your whole life. Why you think they have TV and have these sodomites on it? They run your life. They tell you every move to make 100% in.
Age 21, between the ages of 21 and 29, you're getting a pap smear every 3 years.
Wow.
After that age, until...
They still tell you to get a pap smear, but every 3 years. There you go, people. Like I say, they control your life. And I told you, just keep yourself clean. You don't need to be doing all of this shit right here. It's bullshit, 100% in.
At the age of 65, you have choices. You can either continue with a pap smear every 3 years. You can do an HPV test every 5 years, or you can do something called a co-test, which is an HPV and a pap every 5 years.
Yes, and don't worry about, like I say, you keep looking, you will find what they tell you to search for. 100%. You have to understand that. They tell you to look for it for a reason. They know you're going to find it.
HPV and the PAP use cervical cells. It's the same procedure, but they test for different things. And that is obviously done outpatient in the GYN office. And I just feel like after I've stopped having kids, it's like, I still have to go.
This one says, stop having kids. It's a man in a drag. That's what you need to understand. None of them is what they say they are. You have to get that. Either a bot or a damn drag, a masked up character right there in front of you.
Yeah, still important. Yeah, still important.
Real quick, blood test for Alzheimer's.
Okay, the Holy Grail. How can we diagnose, especially preclinical, before people develop symptoms? This is a blood test.
People, they're talking about Alzheimer's. Now they have a blood test to check if you're gonna have Alzheimer's. This is not the first time they say these things. Like I say, all of these things is on the table now, people. No lie. It gonna be worse than you ever seen it. These supposedly, Alzheimer's and dementia and brain fog, all of it gonna show up. Like I mentioned, is the juice. It's gonna turn your brain into soup. That's what it do. They give you these dose of chemical to start out. And then they also following up with boots. You see what I'm saying, people? They're making sure you have enough chemical in your body to destroy you. Don't even worry about the ones you're taking in with the food, water, all of these things that they give you to use. And then they're going to shot it directly in your bloodstream. What you think was going to happen? Why you think so many things back on the table, including these cancers?
It's been developed by a particular group that showed that it was able to detect with about 80% accuracy via a blood test what we call biological Alzheimer's disease. What does that mean?
Biological Alzheimer's disease. Let's listen. If they're going to say what we think they're going to say. Listen. Listen.
What we call biological Alzheimer's disease. What does that mean? It's a blood test for something called tau.
Wow.
It's another protein in addition to amyloid, right, that we know can...
They're full of shit, people. As you could see this sodomite explaining to you, they can't get by with this fuckery and smart people. It's all bullshit they're describing. As you could see this one talking with their hands. A damn puppet on the masses. Again.
Cause or is partly responsible for causing Alzheimer's disease. Why is this test so important? Well, right now, to get diagnosed with Alzheimer's disease, you either go very expensive PET scans, testing of your spinal fluid. It's invasive. It's
all of these things that they use to testing you is AI, people. You have to understand some all kind of radiation they have in your body doing these supposedly testing. You got to understand CAT scans and all. Now they're talking about animal scan, a PET scan. What a joke for the masses.
This is a blood test that you could theoretically do in the doctor's office. Right now, it's not commercially available, but stay tuned. I have a feeling that this is going to be something that we might be able to see.
Yeah, it's not commercially available. As you could see, the devil horns right there on the hands. They play too much. This is how they sell you the destruction. And the mass is never going to understand.
Even if you test positive, doesn't mean you're going to develop. And if you test negative, it doesn't mean that you may not have another type of dementia. But I love this idea that we're moving away from these expensive research only to something.
Yes, because they want it easier now. They want to make it easier. Like I mentioned about the insurance, will make those supposedly expensive scans and these things come down to price that you can afford. And now they're telling you they're dropping the price literally, like I tell you, because they want to diagnose more people because, yes, their brain is now soup. Move.
When I was first diagnosed, I couldn't even say the word cancer, let alone...
And pay attention to these people right here. Now they have all of these clips out to show you what to do to survive these cervical cancers that the woman been having right now more than ever. So now they have to show you what you need to do, just like that woman on TV, that man in a drag, trying to show you what move to make because they want to take full control of you. So pay attention to this right here. As we give it
tell people that I had cancer. I was kind of sitting there, and
see,
the first feeling
up right there to show you. Listen.
Shock, I would say, probably. And then for me, I was sitting there, and the doctor was my OB who had told me. She was sitting next to me, talking, kind of showing me what it potentially looked like, and describing kind of next steps. I was sitting there staring at the ground. I couldn't really look at her. I couldn't really look my boyfriend in the face because I knew that if I looked up, I would just start bawling.
And that's what they do. They basically easily diagnose you with cancer. And I told you already before, it don't necessarily mean that you have cancer for real. I ain't playing. The seeds already planted in you. I already told you that long time. All these things that we taking in plant that seed of the cancer, they only need a dose of chemical to trigger it off. No lie. Is when chemical take over your cells, is they call cancer. And then these treatment killing your damn cells to get rid of the cancer. So these people that tell you that they survive cancer, they're full of shit. 100% in. And like I tell you, the doctor can tell you, they diagnose you with it and all, and start this deadly treatment to kill off your damn cells. Listen.
Hi, I'm Mila Lazarevsky, and I am a cervical cancer survivor.
And we never see you one time with the hair fall off. Pay attention here, people. It's showing you that what? What is showing you? That it's thin right there and you could see some creases in it. What is it showing you right here to show that this one actually have cancer and survive it? Listen.
There were...
brow ridge on it and everything. It's not even real woman. They show you right here. But pay attention.
About 2 months before I was diagnosed, I started feeling this little lump inside of my cervix. It turned out to be inside of my cervix.
Okay, so you was the one who check in and you feel and you find these lumps inside your cervix. Okay, listen.
And I didn't really know what it was. It wasn't painful or anything. It was just kind of there. And then about a month before my diagnosis, I started bleeding after sex every time, which I later found out is the biggest indication of cancer.
There you go, people. The biggest indication of cancer is you bleeding after sex. And these are what they're going to tell you right here for you to run to the damn doctor. And they start the procedure. Listen, because they're telling you, basically, once you bleed after sex, that's what it is. Listen.
But the way that I was diagnosed was just from a routine pap smear, came back with irregular...
Go back again.
But the way that I was diagnosed was just from a routine pap smear.
Does that make sense, man? You talk about the lumps. You find the lumps in you. You're talking about you bleed after sex and all these things, and then you just go for a regular pap smear check, and that's how you find it? Listen.
Came back with irregular results with, I think it was squamous cell carcinoma. And
what?
That
That's
just...
the name of a chemical? Okay, listen.
I already knew that I had HPV, so I wasn't really worried about it. And they told me to get a colposcopy. I actually ended up putting that off for a couple months because I had a trip planned to the Bahamas. I had just started a new job. It wasn't something that I was really prioritizing. And because I had already known that I had HPV when I was 19, I thought it was just something kind of related, but not a big deal. So when I went to go get my colposcopy was probably in the beginning of August, and I had a follow-up appointment set up with my doctor to come in about a week later to get my results back and talk. She actually ended up calling me a couple of days after that initial appointment and asking me to come in, which raised a little bit of a red flag, but not too much. I thought maybe I have an infection or something. And then when I came in, I actually had brought my boyfriend at the time with me to the appointment because she had asked me to bring someone with me, which also for some reason at the time didn't set off that big of a red flag, but should have. And that's when she told me my stage was one.
Take a look at this right here, people. There go the markings right there to show you this one of the cervical cancer right there. I guess that's where they're supposed to be doing some kind of operation. Listen.
One, which means that there was a tumor, but it was below, I think, 1.3 centimeters. And in that, but it was larger than, I think, 1 centimeter.
And take a look, people. They have to show you this one fold up in the hospital with a little smirk on the face. Yes, this one have cancer with a full load of hair. And they do give him the chemo. What a damn joke. What is this right here they're showing you? Move.
Centimeters. Because of the staging that I had something called a radical trachelectomy, which is where they just take the piece of the cervix. I think it was 2 inches or so. And luckily my doctor was trained in doing that type of surgery. And
yes, of course they train in doing those kind of surgery. Cut out a piece of you real fast and tell you you're good. Listen.
So did it laparoscopically and was trained on the Da Vinci machine. So we were able to not have to, I was able to not have to have a hysterectomy. So after I had...
Oh, okay. You was able not to do a hysterectomy. I don't think so, people. I don't think so. You better wake your ass up. As soon as none of those problems come up with the cervical, they're taking out everything. That's what they call a hysterectomy. Because like I tell you, they like to destroy the woman. The hole inside that makes them a woman. They like to destroy that so they can't produce anymore. Like I mentioned in my podcast, to show you that this is what the world is about when it comes to depopulation. It gonna comes to a time where the human being gonna pause. You have to understand, of course, that's what they're working on. They're coming up with all of these things so they can take out the woman inside. They already have man with erectile dysfunctioning and all of these things. This is what they're doing, low sperm count. They want to stop the supposedly producing of the human being right here in the tracks. Listen.
I was able to not have to have a hysterectomy.
And the way you're talking, we don't believe it. Listen how we talk, people, about the hysterectomy, of it avoiding the hysterectomy. Listen.
In doing that type of surgery, yes, and he also did it laparoscopically, and was trained on the Da Vinci machine.
Da Vinci machine? Which one is the Da Vinci machine? The one that take you from a man to a woman or a woman to a man? Listen.
So, we were able to not have to, I was able to not have to have a hysterectomy.
You lie.
So after I had the surgery, if my lymph nodes had come back clean, that would have been the end of it. I was actually sitting in my oncologist's office when he got the results because they hadn't come in yet. So he called the lab to find out the results. So I found out at the same time as him that it had metastasized to 2 of the, I think, 6 or 8 lymph nodes that he had taken a test. And then immediately in that office, we were sitting there. He called a colleague of his who was a radiation oncologist to get me set up with an appointment with him. And we laid out a plan for my chemo and radiation regimen.
You hear that? Bam! You see what I tell you, people? Don't follow these people. They come with a procedure because they want you to follow this track of this supposedly female right here. And I told you it's a faker. So yes, they go to radiation and also chemo. There is no chemo that don't take off the whole... Alright, you're wearing a wig. I'm going to just put it like that then. You're wearing a wig. Because the chemotherapy killing your damn cell, even the hair cell. That's the first thing it go for. It kill every cell that you have in your body if they keep it up. So therefore, the masses can't come back from that shit. Even if they tell you you beat the cancer, how much cell you have left? You don't get it, people. Remember, the cancer take over your cells. They have to kill the cells to get rid of the cancer. They don't have no cancer treatment. They have cell killers. So you have to pay attention. Don't follow no regimen that they give you when it comes to this cancer. Why? Because they're the one who give you the cancer. So what they're gonna do when you show up and tell them that, and they say you have it. You show up and say, hey, I got this problem, and they say, yeah, you have it. Now they're gonna finish you off. Don't let them too push it in your head about these people use, radiation and chemotherapy and bring them back. It's fuckery. Move.
Florida Surgeon General recently called for a halt in COVID vaccines due to safety questions, while the federal government continues to heavily promote them for adults and kids alike.
Listen, people, I did a video on it with the Surgeon General of Florida talking about he want call for a halt of this issue of the vaccine. But it's bullshit. He called for a halt. They didn't even halt it in Florida. You understand what I'm saying? They didn't even stop it in one of those fucking areas that they're juicing up the people. So that just talk. You have to understand that we've been saying the same shit from ever since before they start juicing up the people, what gonna happen. And now these people acting like they're coming out, but they can't stop shit. Pay attention here.
Today we begin with a little told story about COVID vaccine injuries. It's the story of Maddie.
Of course, the Maddie character, I did a video on it already. I talk about it already in my podcast with these people promoting the vaccine and crying now that it actually hurt them. Let's listen.
Children who took part in Pfizer's vaccine study on children.
Wow. Why did you do that? Which dummy in this world decide that they come up with the fastest vaccine ever in life, the fastest vaccine ever for the most deadliest virus the human being ever sees, supposedly. And you have your youth and use them for a guinea pig to try out the supposedly shot? Why did you do that? You don't have no answer. It's fuckery. 100%
remarkable account of what happened when Maddie got very, very sick, leading to accusations that Pfizer, the FDA, and the study leaders tried to bury her case.
Study leaders, they all fake. They never do no study. They give you the shot. That's where they study at when they watch what the reaction is. Right there when they give it to you.
All three of my kids were in the Pfizer clinical trial.
Why? Why did you use all your kids, you piece of shit? As you could see the key right there to show you they're full of shit. They hold the key to all the shit right here that they give you. All the deception in the world. So pay attention. You have 3 youths, 3 of them. And you take all of them for guinea pigs for Pfizer vaccine. The fastest shot they ever come up with. And now you're gonna cry that they're sick. This is the dumbest shit in the world. And guess when it gonna come out, people? After people take the damn shot. After they supposedly do it. And they come out and say, yeah, we did it. And now you let the youths get vaccinated. And now you're gonna come and say, yo, look, my youth was damaged. Look at this shit right here. You already did it. Like I mentioned, that doctor, supposedly that fake doctor on YouTube that get a lot of people take the shot by tricking them and tell them that he take it, and now he telling them it fuck him up, so he don't want them to take it no more. After a couple of years, you don't get it. He wait them, let them all of them take it, and he wait, and now he gonna tell them the destruction of it. You see how the devil work? Listen.
For 12 to 15 year olds
Look at this faker right here. Look at him.
Children's.
Look at them people. These are the supposedly youths that they give the shot to. Pay attention right there. Why did they get chosen by Pfizer? Why did they choose to go take that shot? As a fucking trial, people. They wanted to try it out. Why? Listen.
In summer of 2020, Stephanie DeGarry and her family learned an important clinical trial was about to be launched at nearby Cincinnati Children's Hospital.
How did you know about it? As you could see the big C and the little C right there. CC33 coding Freemasonry. How did you hear about this study to tell you how your kids in it? Wow, unbelievable, dumb shit.
It would test Pfizer's experimental COVID-19 vaccine.
Experiment, people, and look what they call it, biotech. You don't get it, people. Technology you're injecting in your bloodstream, and I already told you. I told you I never miss. This is the most advanced technology you ever see. That's what you're looking at right there in the vial. Oh, you thought it was a cell phone? Oh, you thought it was ChatGPT? Oh, they dumb you down enough to believe that it's a ChatGPT is the best technology, or the most advanced technology, I should say, my bad. The most advanced technology that they ever come up with is this shit right here. Why? It's actually gonna control you, mind and soul, right here. This gonna control how you work, how you listen, how you think, how you process things, right there. This right here. You never seen a technology like this, a biotech. You see that, and it come from one of the wickedest devil peoples on earth, the fallen angels. They're the one who have all of these people doing these things to you. They're hidden in the background, and they have these people to convince you of a damn virus so you can do this right there for the destruction. And almost everybody gonna get caught in that web.
On 12 to 15-year-olds to see if it was safe and effective. The DeGarrys, firmly pro-vaccine, didn't hesitate to let their children take
pro-vaccine. What do you mean? Okay, go back again. Listen. Again.
To 15-year-olds to see if it was safe and effective. The DeGarys, firmly pro-vaccine, didn't hesitate to let their children take part. Among 3 siblings, 12-year-old Maddie alone was...
Maddie coding, as you could see, all diamonds on the clothing. Diamond 33 numerology for Freemasonry. Look.
Chosen to get 2 doses of Pfizer's vaccine rather than a harmless placebo. It proved a fateful and debilitating roll of the dice.
Her second dose was January 20th of 2021.
Yes, and January 1st. That January is 1, okay? And the 20. That's how you get your number 3. And don't worry about the 2021. Listen.
Her second dose was January 20th of 2021. 21. And that was my son's 16th birthday, literally the day. I have a picture of the three of them.
Take a look right here. They got picture of the three of them, and this is how you know, people. And all of them got the gear on. Don't worry about it. This one right here with the XXL 66, and the L is a number 3. But pay attention. All of them knows bag up right there. All of them knows tie up. So you follow procedure, and you also bring them to get the shot. What is that right there? They're drinking Sprite. Wow, watch this right here.
On that day. That night, in the middle of the night, that's when it all started. So it was maybe, let's just say 12 hours after.
12 hours, number 3, coding.
Her second dose.
What kinds of things did she wake up with, or was she suffering?
She just came in and asked if she could sleep in our bedroom, which was not normal. She said, I don't feel right. Can I sleep in your room? So she slept in between us.
Look at this thing right here, people. Both of them look fucked up. But like I say, people, they're here for the deception. Take a look at it right there. This one basically vaccinate all the youths with a trial, a vaccination trial, and you throw all the youths in it that you have. What a dumb shit, people. Listen.
So, very odd. And then in the morning, she ended up going to school just because she hates missing school, because then you have to make up the work. So by the time she came home from school, my husband called me at work and said, Maddie's having some sort of reaction. She had, like, what she described as electrical shocks going up and down her spine. She said she felt like her heart was being ripped out. So chest pain. She had severe abdominal pain. She was hunched over when she walked through the door. Her toes and her
What, you forgot now you have to stare down to the script? What's going on here? Look.
fingers were white, and they were like, when you touched them, they were ice cold and painful.
Did you think right away that this was probably a vaccine reaction?
100%. There was nothing wrong with her prior to that.
Take a look now, people. Look.
Before long,
This is the daughter right here in the plaid shorts right there. Take a look. You gotta basically use her hands to move her legs because they're dead supposedly. Pay attention here.
Maddie
Look.
lost feeling in her legs.
Lost feeling
Here
in
she's
her leg.
scooting on the floor and using her hands to lift her legs.
And guess what, people? They have this shit recorded. They're trying to record it because they know they're gonna be on TV. 992, 1992. Okay. Coding. Pay
Harry
attention.
says she was shocked when the lead study doctor offered no help. She found herself reluctantly following the advice of physicians who insisted Maddie's paralysis, seizures, passing out, all of it were caused by anxiety.
I'm embarrassed how much I was brainwashed and believed them. She did cognitive behavioral therapy, which is seeing a psychologist.
At what point did you think to yourself, I've tried what they said. I know my daughter's not suffering a psychological event.
I always had in the back of my mind, I knew that it wasn't.
So from day one, you said the first reaction your daughter have, you know 100% that it was a vaccine reaction. Anyway, when you go to the doctor, they tell you something else. And you also didn't believe them, but you still go on. Listen while you pay attention.
When she was in her hospital stay in April, they treated her horribly. Like, they treated her like a crazy person. And at that point, I knew. Plus, she wasn't getting better.
Look at this right here, people. Pay attention. So this is the reaction right here. This one having somebody hold the camera while this shit is going on. You believe it, people? Unbelievable that they pass these things off as real. We already know what this shot do. But like I tell you, when you have to make up shit, it makes no sense, people. Why is they doing this? Because it's the same people. The same people who shot you up. They're the one who give you this footage. But like I say, it's actually too late. Listen.
Maddie was rushed to the ER 9 times.
9 times, right on the money. Don't worry about it. It's just coding. Listen.
Time she was hospitalized for the third time. She had heart problems.
Third time again. Number 3 coding again. Listen.
Was passing out, vomiting, unable to swallow, and was fed through a tube. She was in the hospital that time for a month and a half.
Hey, welcome back.
Oh, welcome back. So it was passed out and they recorded it the whole time until he come back and crying. Pay attention here.
Studies are conducted to identify and investigate any health risks. Maddie's reaction was a giant red flag for Pfizer's vaccine. But
still, people, it was a giant red flag. And I'm going to ask you a question, people. This is a very important question. Why did they do these studies? If the reaction wasn't gonna, depends on if they send it out or not. You get what I'm saying here? Okay, why did they do the trial and they go put the vaccine out there anyway? This is fake shit. I already don't tell you it is fake shit. You got to understand. So Pfizer do these supposedly testing that everybody that gonna see it, people gonna see it. They're gonna see the reaction like with this woman right here, put 3 youths in it one time. And all of them take the shot. All of them supposed to be reacting now. Maddie's is supposed to be worst one right here. So I'm saying with those supposed to be reaction, why did the shot didn't halt? Why they still put it on the table? And I'm assuming that this was before the issuing. Because if the test gonna matter, that means the test done before they issue the shots. Okay, and you have this reaction and you still put out the shot. So what was the testing for? The testing is on you when they issue that shit. Just remember that. They didn't have no trial and these people tested. When they put the trial out there, the vaccine already issuing to everybody. Listen.
Juries say those involved seem more interested in blaming Maddie's illnesses on anything but the obvious culprit.
Listen.
While Maddie was fighting for her life, the FDA...
Yes, I guess this time now, they should have just called it long COVID. You get it? Exactly. That's what they put the long COVID name right there for. To absorb things like the vaccine reaction. You got it? It's all a stage, people, and the devil is working hard to convince the masses of their plan is the right plan. Right here with a
granted
bam.
Emergency use of Pfizer's vaccine for kids as young as age 12, based on the study Maddie took part in.
Go back.
For her life, the FDA granted emergency use of Pfizer's vaccine for kids as young as age 12, based on the study Maddie took part in.
You hear that, people? Based on the study that Maddie took part in, the one that lay her out right there, that's why the federal government or the FDA decide to put an emergency use on it. Do you understand? That's why they put it out there for emergency use, because they see these. You got it? Move.
In a press release, Pfizer reported its vaccine had a favorable safety profile observed across 6 months of safety follow-up data after the second dose.
Yes, so hold on. What happened to the 7 month, 8 month, 9 month, 10 month, 1 year? You can't do a study when you take that dangerous chemical in your body and 6 months. You got it? Okay, so I'm saying, what happened to the study when you have it in your body for 6, 8 months, 9 months, 10 months, down the line, a year? What did I tell you? You have to test it further than that before you can guarantee that somebody having that shot in the body a year, they're still safe without reaction. Don't? But they only tell you about 6 months. What did I tell you from day one? It would take a few years before the vaccine start destroying people. Now, some people immune system take a hit in the supposedly pandemic precaution that they take with the mask and the 6 feet apart, locked up in your home, all of these things, the disinfectant, bleach, all of these things. So guess what? Some reactions show up earlier in them. You have to get it. The people who die from it real fast, the people who sick and take the reaction real fast, their immune system was compromised. You have to understand, they really want it to serve you a little bit long so nobody can point the finger at that shot. They want it to be a few years before it starts kicking in. Pay attention.
No mention of what happened to Maddie. Parents across the country started rushing to get their children the heavily promoted shots.
There you go. The heavily promoted shot. As you could see, this one have to hold a sign because he can't talk. Why? He got the bag on the nose and the mouth. He can't breathe and he can't talk. So it hold a sign to tell you what the fuck it want or what it's saying. As you could see right there. You see? You better wake your ass up. Nothing real. They're just faking the masses to take this shot. It's called order chaos.
You were super
There you go,
duper
right
today.
there.
Getting your COVID vaccine, Elmo.
Yes, and I did a video on this just to show you they got your youths easily wrapped up in these, youths programming that they give you, and you left it and turn on it and just leave it for your youth to take it in. You don't get what they're doing, poison their subconscious mind. They're growing your youths for you right there, hypnotism and all.
There was a little pinch,
There you
but
go.
it was okay.
There you
I
go.
took a trip up there to the
And
north.
there you go. This sodomite right here, he was also on there. They have to use them to sell you the damn destruction of the earth.
Pole. I went there and I vaccinated Santa Claus
There you
myself.
go. You
It
hear
sounds
that,
like
people? He went there and he vaccinated Santa Claus himself in North Pole just to get everybody juiced up. They even use the Santa Claus, the big man that they give you, coming to your chimney with gifts in Christmas. You hear me? The same Christmas that they tell you is for Christ that died for your sins. They give you a fat man in a red suit. You don't get it. Everything is an illusion.
you have the sense that government / the drug company and study folks did not want to acknowledge this as a vaccine adverse event.
No, they did not.
And you feel they were not honest about
No,
the
they
reporting of her case.
They left out a lot of information. They reported it as functional abdominal pain, so it's basically a stomach ache.
I'm going to ask you a question. Why you didn't say nothing while these things was going on? But now, way after now, from 2020, this thing went down. And now you come 4 years later to tell it to somebody on the news, basically, to give your story to a reporter so they can broadcast it. How it gonna help the people that already take the juice? It's dumb, people, 100% dumb. Like I said, they already know it's water under the bridge, more like spilled milk. You can't go back. Move.
HealthWorks, a new app, can check your vitals with a selfie. Dr. Renee Dua, founder of Together by Renee, joins us live to tell us all about it. Good morning.
You hear that, people? Now they can use a selfie to tell if you're sick, as you could see the serpent right there intertwined on the pole with the wings to show you. The devil control you right here on earth using the healthcare industry. Watch this.
Welcome to Houston's morning show.
Good morning. Thanks for having me.
I find this so fascinating that a selfie can tell you so.
And take a look at this vagabond right here, the way it explaining it, trying to get the masses all involved in the government system, the devil system that gonna lead you to your destruction with all those supposed to be technology and AI coming into the medical industry. I already told you, it only takes something for malfunctioning and then it gonna affect you. You hear me? I should say it takes nothing for these things to go malfunction and then you start having problems. Listen.
Much about it. A lot of it has to do with the eyes.
Yeah, with the eyes. Look.
It's actually more the skin. Under the
skin.
blood vessels, the technology that's used is able to look at the spectrums of color.
Yes, more technology for your ass to diagnose you with shit. Do you get it? Because I already told you the new world is the doctor gonna be in a app, a phone. You go there, you put in some number, you tell them what you want, they ask you some question. I'm talking about the AI. And then they're gonna diagnose you and tell your prescription. All you have to do, drive to your local pharmacy, Walmart, CVS, Walgreens and them, and fill your prescription. That's what they do, people. The new world, the doctor not even gonna be there. Listen.
Based on volume, make an assessment of your blood pressure. It's pretty cool.
There you
That
go.
is incredible.
So it's incredible. All AI people gonna control you in this earth. The fewer you that gonna leave here, that's what you're gonna get. Nobody understand that the depopulation already happening. There's less people here. Now you go out there and you see more cars. That's what people use to judge that, oh, the place is full with people. But you don't get it before. Wasn't that supposed to be people driving. There wasn't that much people supposed to be driving. But now, yes, they are. Now Uber, all of these driving, Lyft and all of these, they're the one who occupy the road. And you have to understand this is how they do it. Less people, and now they're carrying in more cars. You got to get it. So now you see the roads jammed up. It feels in your mind, or your mind telling you that yes, more people is around, but the people is already depopulated. That's why they don't need people to do nothing now. All AI. Listen.
Is this app ideal for? Who is it designed to help?
Who is it designed to help?
Well, so the story behind TogetherApp.com is that I'm a physician, but I'm also a caregiver for my parents. I don't live near them, but I want to keep an eye on them. I want to nudge them to
Yes,
take their...
but you're not gonna be the one who really keeping an eye on them. It's a system that you just attach to them right there with this damn app. You're not the one who gonna watch them and monitor them or taking data. It's the government people give you that shit.
Or check their vitals. And so I was really inspired by my own parents to build TogetherApp.
What a dumb
Now,
shit.
it's not just vitals either that you can determine. What can people get from scanning a pill bottle?
Listen.
Right. And so that was really important to me. I didn't want any person to have to type in the name of their medication or remember which pharmacy they filled it at. And so if you literally just scan your pill bottle like this, it will build your health profile. TogetherApp.com will tell you what medicines you take, when you take them, when refills are due,
Yes,
which
and then you don't need the doctor. You got it? Like I mentioned, people, I'm not stupid. I show you those people how they was deceiving you in the pandemic. The nurses, the doctors, and all them, they go viral on TikTok. Dancing. They coordinated and everything. Like they've been practicing for years. Like they've been rehearsing for this supposed event. Every single day, they're posting these dancing videos. Nurse and doctors mocking the masses while they tell you they're overwhelmed with COVID patient. They have time to entertain you, dancing and all. There was a part of the world stage, and guess what? They're gonna take them away. Just in case you don't know, they let them run the deceptions. All eyes on nurse and doctors and all the healthcare industry. And then they're gonna remove the people and use apps right there. That's exactly where they're going. And you might think I'm joking, but it's closer than you think.
Fill them and will actually call and get those refills done for you, which is really awesome.
Well, that sure sounds convenient because it's so easy to wait until the
so
pill
easy.
bottle's empty and then you get yourself in trouble. It's really amazing what AI can do.
Yes, it's so amazing, or really amazing what AI can do. You see that? Like the human being couldn't do that. Do you get it? I already told you the reason why human beings so fascinated with AI is because they're surprised that it actually can do things that you should have been doing. That's what amazes you. I already told you, this is wrong. They mimic you, and now you're amazed. I already told you, all AI system is mimic human being. The brain in that make the AI, the chip, is a copy your brain to make a chip to function a damn AI. And now what? The AI is smarter than you for you to give it the lead way, like you're so amazed that it can do these things that you can do with your eyes closed, but you're amazed because a device do it. This is unbelievable. I've seen people going crazy about Siri and how they can have a conversation with Siri. It's so amazing. But you forgot that you can also have conversation with a real human being? You see what I'm saying? Because it's amazed you that the device having a conversation with you. You rather the device. You don't get it. It's stupid shit, people. In a dumbed down world, AI is the dumbest thing in the world. And now they're gonna bring it to the medical industry to finish you off. Yes, it's another mag bam. I'm always on the run.